Welcome to the Mama Submit YouTube channel. In this workout, we're going to be doing 30 minutes of birth preparation to help open all of the different parts of the pelvis, release tension within the pelvic floor so that you can feel more comfortable throughout your pregnancy as you prepare for birth. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and in this 30-minute workout, we are going to create space in the top of the pelvis, the middle, the bottom of the pelvis, and release tension in all the different parts of the pelvic floor. As we move through the workout, I'm going to explain how we create space and why we want to create space in each of the pelvic levels, in addition to some common restrictions that you may notice in your own body that are normal adaptations as we navigate through pregnancy. For this workout, all we're going to need is a yoga block, some weights. It can be 1 or 2 dumbbells of your choice, and 1 mini band. If you want to have some pillows and different props available to you, feel free as well. And as just a note, if you like this workout and you want more workouts like this to help you stay strong throughout your pregnancy as you prepare for birth, check out our online prenatal fitness programs. We have our online prenatal strength program, which is going to be self-paced workouts that are great for somebody that likes to work out in a gym setting, but is looking for some prenatal modifications to continue lifting safely throughout pregnancy with all of that amazing pelvic stability and birth prep work. And we also have our video-based program, which is our prenatal on-demand program if you prefer to follow a video and work out with us at the same time. Both programs can be started at any point throughout your pregnancy because they sync to your current week of pregnancy. So if you want to check them out, head to our website after this workout and use code YouTube10 to get 10% off any of our online offerings. So once you got your equipment, let's go ahead and get started to create space in the top of the pelvis. So we're going to need a yoga block and 1 or 2 weights to begin with. So we're going to start with squat therapy. So using your yoga block, you can sit down to the block, and we're just going to start in a deep squat position, but we want to be relaxed in this squat. If you need to put something underneath your heels, like a rolled up yoga mat or maybe some wedges, because maybe ankle mobility feels a little restricted, feel free to do that as well. But we're just going to start in this deep squat position, and we're going to place our elbows on the inside of our knees. And then just gently press out against the knees to feel more of a stretch in both of like your groin and inner thigh areas. And then you can just release, and we're just going to kind of push in and out to create a little bit of space and mobility in the top of the pelvis. So if we want to create space in the top of the pelvis, known as your pelvic inlet, we're thinking both knees are more externally rotated. So ankles are in, knees are out. In addition to, we have hip abduction. So the legs are moving away from midline. This wider leg position helps to create more space side to side in the top of the pelvis, which can be helpful to allow your baby to engage into the pelvis. So we're just pressing the knees out. If you want, you could also remove the yoga block. This is going to allow you to sink a little bit deeper into the position. So if you feel like you have the mobility, you can go there, or we can come to a lower level on the block as well. Now, in addition to mobility, we also need strengthening as well, because our muscles only have the ability to pull, not push. And so we need our muscles to be strong enough to pull our pelvis into different positions. And the way that we're going to create space in the top of the pelvis is going to be a squat position as well. So you can either hold weights in front of you, you can hold weights on just one side or both sides, but we're just going to hold on to some sort of weight. Feet will be a distance that feels comfortable for you. Take a big inhale into your lower back, and then lower down to a point that feels comfortable, and then exhale, drive through the feet to stand up. So we're going to inhale to lower down, and then exhale to drive through the feet to stand up. Now we're thinking about maintaining that even tension or the even weight distribution between both feet. So as I come up, I don't want to shift all the way to the right. I don't want my feet to kind of roll out to the sides. I want to think weight is in the big toe and the pinky toe side as I come up and down. And now as you lower, if you feel any discomfort in the lower back and the hips, just kind of go to a point that feels comfortable for you and then stand back up. So we don't need to do a full squat. But squats are going to help to strengthen the quads and the glutes, which helps to create space in the top of the pelvis. Now, in addition to the side-to-side opening of the pelvic inlet, we also want to think about the rib cage positioning. So can I find more extension? Likely yes during pregnancy. And can I find more of a rounded position? Because this is going to help to create space front to back in the top of the pelvis. So we're going to start with a lat release. Stand next to your door frame or a sturdy structure, and you're going to reach across your body to begin the stretch. Come into like kind of this hinge position, so my feet are stepped back from my hand. And then I'm going to push to the wall to feel a big stretch through this side body. And then making sure that that chest is square to the floor. So we're releasing the lat muscles here to help us find a more rounded position. So again, you should feel a big stretch through this side body. If you're not feeling much, you may be like really aligned. So we want the feet to be a little bit back, and then we want to think chest is square to the floor. You can think a little bit more weight in that outside foot as well, and then press hard through that hand. During pregnancy, the lats tend to get a little bit tighter and shortened, which can make it really hard for us to find that rounded position, which is really important to creating space in the back part of the top of the pelvis. Let's go ahead and switch sides. So arm reaches across. We're going to come into that kind of L position with our body. Chest is square to the floor, and we're going to press through that hand. And then making sure that your feet are stepped back a little bit, so about like 1 or 2 foot lengths from where your hand is. And then we're pressing through that to feel a big stretch through this side body. So one of the things that can make it harder for baby to engage into the pelvis is if you cannot find a rounded position when we're kind of stuck in extension, so we're stuck really arching in the spine, it's going to push baby over that pubic bone and sometimes makes it hard for them to drop back into the pelvis. So incorporating lat releases into your routine can be super helpful. 1, it's going to feel really good, and 2, it's going to help create space in the back part of the top of the pelvis to help your baby engage. Now, in addition to the release, we also want to think about the strengthening aspect as well. And so if we're trying to focus on, can we find this more tucked position, we want to think about what muscles are going to pull us into that position, which is going to be your abdominal wall. And so we're going to hold on to 2 weights or just 1 out in front of you. So almost make like this like L shape with your arms. And we're just going to march in place here. And so you're going to feel your front abs turn on a little bit more to keep you in this upright position. And then as you march, we want to make sure that we're not leaning backwards into it. We're trying to maintain this upright position, and you'll really feel your ab walls turn on a lot more. If it feels like too much, just bring the weights a little bit closer to your body. If you want a little bit more, hold the weights out a little bit further. So you can absolutely train your core throughout pregnancy. It's important to do so. We just want to do it in a way that makes sense for pregnancy. So we're not exactly trying to do like tons of crunches and sit-ups or things that overload the core to where we begin to compensate. But we do want to have a strong abdominal wall that is flexible to help support baby's positioning. Now, in addition to the top of the pelvis, we also have a middle of the pelvis that baby needs to begin to navigate through. So we focus on opening the top of the pelvis side to side with those wide leg positions, strengthening in that position, and then we focus on the front to back movement. For the middle of the pelvis, we're thinking more rotational and one-sided movements. So we'll start with the feet spread out a little bit wider than hip distance, and I'm gonna take my right hip and try to touch my left knee as I sit back into my left hip. So I'm thinking kind of like sit back diagonally into this hip as I try to take this right hip and bring it towards that left knee. So I have weight in both big toes. I'm feeling this big stretch in my right side inner thigh and groin. This knee is not flailing out to the side, and I'm continuing to feel that stretch. Now that right hand can reach across to touch the left foot or towards that left foot. It's not going to touch. And what this is doing is it's helping to create space in the upper mid-pelvis. So this leg's upper mid-pelvis is being opened and stretched a little bit more. So we're feeling more of that groin and inner thigh stretch. This is an important place because this is where baby begins to rotate into the pelvis. And for some of us, the right side, like the right upper mid-pelvis, right anterior pelvic floor, may feel a little bit overactive or a little bit more tender. And now let's shift to the left. So same thing, I'm thinking shift back into my right hip. I'm trying to bring my left hip towards my right knee. Weight is in both big toes. So it's feeling that big stretch in the left inner thigh groin area. So now my left upper mid-pelvis, left anterior pelvic floor is being targeted in this stretch. You can think reach across with the left hand towards that right foot. And so when we're thinking about movements to help baby begin to rotate into the pelvis to create space in the upper mid-pelvis, we're thinking one-sided externally rotated position. So one-sided open hip positions helps baby begin to rotate. And this is going to be our mobility movement. In about 10 seconds, we're going to shift to alternate from side to side, adding in some thoracic mobility. And then shift your weight over towards the left, thinking right hip comes towards left knee, and then alternate to the other side, adding in this big twist with the upper body. So I'm really thinking about reaching towards the other foot to add in a lot of twist and rotation in that thoracic spine. So in addition to the front to back movement of the rib cage to help support opening the pelvis, we also want that rotational movement in the rib cage to help create space in the pelvis as well, because the rib cage and your pelvis are both attached to the spine, and so movement or lack of movement in one place can influence movement or lack of movement in the other place. So we've got our rotational pelvic mobility movement with a rotational thoracic mobility movement. Now let's do our strength movement to help create space in the upper mid-pelvis. And we're thinking about movements that are going to target more of like the glute and the quad. And so I'm going to hold the weight on the same side as my work leg, and we're going to come into a staggered stance or like a B stance squat. So I'm going to step my left foot back. I'm going to start with my right leg forward, and I'm holding the weight in my right hand. This is going to help bias this hip a little bit more externally rotated as well. So inhales to lower down, and then exhale to stand up. Think about keeping most of that weight in that right foot or your forward leg. So as I lower down, my belly is going to kind of come more inside of my right leg. So it's going to bias a little bit more external rotation because I'm holding the weight on the same side. So this bias and external rotation is going to help to target more of that glute. More of this upright squatting movement helps to target a little bit more of the quads, which are both really helpful to creating space in the inlet and the upper mid-pelvis. About 10 seconds, we'll switch to the other leg. Let's go ahead and switch the weight. So weight's in the left hand, left foot is forward. So weight in the same side again is going to bias that hip more externally rotated. So this is known as like an ipsilateral loading or loading on the same side. This is going to help to target the glute a little bit more. And more of this squatting upright movement is going to target the quads a little bit more. Both really important to pull the pelvis into a more open position in the upper half of it. Now, in addition to the open hip positions where my feet are planted, I also want to have some open chain movements. So go ahead and take your mini band and we're going to place it above the knees. So when my feet are planted and my pelvis is rotating on that femur, this is a pelvic rotation movement. When my hip is planted or my pelvis is planted and my leg is moving, this is going to be my hip rotational movement. So put weight into your right foot and then exhale to bring that left knee out to the side and then inhale to bring them closer together. So exhale out, inhale back in. So when it comes to birth preparation to create space in the upper half of the pelvis, we're thinking about open hip positions with both pelvic and hip rotation. They're pretty similar, but they're just like a little bit different because it depends on what the anchor point is, like what bone is stationary as the other one moves in it. So when I have more of this open chain movement where my foot is not on the floor, this is going to be more of my hip rotational movements because my femur is moving on my pelvis. The other movements that we did in this little mini circuit with the lateral hip shift and the B-stance squat, those were pelvic rotation movements. Let's go ahead and switch to the other side. In those movements, my femur was planted and my pelvis was rotating on top of it. And so we need both when it comes to preparing for birth because they both are helpful in their unique ways to creating space for baby. They strengthen muscles in a slightly different way. And in our prenatal fitness programs, we incorporate all of this for you. All of these different types of movements are included within our workouts really intentionally to help you create space in all the different parts of your pelvis, to help release tension within your pelvic floor. And we incorporate a lot of strength with mobility work. It's not all just squat and lift heavy. There's tons of intentional mobility as well. Let's go ahead and remove the band. And now we're going to start thinking about the lower half of the pelvis. And this is where we're thinking more internal rotation or closed hip positions. So we're going to start with our hip shift. I'm going to stagger my stance so that my left foot is a little bit back than my right foot. And I'm going to target the left foot first. So start with your hands out in front of you. I'm going to open up towards the left side. And then I'm just going to kind of teapot about 45 degrees down. Slight bend in that left leg. And I'm thinking kind of like sit back into that hip. And then we're going to think about weight is in that big toe. That knee is almost rotating in. And then I'm thinking about this right hip is trying to touch that left knee. Like that little visual cue of trying to bring these 2 points together is going to help to kind of compress to bring you into more of a hip shift. So trying to feel this big stretch in this hip pocket, this deep glute area. So if I had jeans on and not leggings, where I'd put my hands in my pockets is kind of the area that I want to feel this stretch. If you're not quite feeling it, I want you to put a little bit more weight into that left foot, a little bit more weight into that big toe, and then really think about bringing those 2 points together, and then just slight tuck underneath of the butt. Let's go ahead and switch sides. So step the right foot back, left foot forward, open up to the right, and then we're going to shift into that right hip. Lots of weight in that right big toe. Right knee rotates in. Thinking about bringing that left hip towards that right knee. You can reach towards the right foot, think slight tuck underneath. So a lot of technicality to this movement. But once you get into it and you feel that stretch in that hip pocket, it's going to be super helpful to stretching the back half of your pelvic floor, to creating space in the lower part of your pelvis to help your baby finish rotate out of the pelvis. So if you're struggling with tailbone pain, SI joint pain, really any sort of like butt stuff like constipation, hip shifts are going to be super helpful to relieving those symptoms. In about 10 seconds, we're going to even the stance. We're going to alternate from side to side, adding in some upper body rotation. So bring the feet even to one another, and now I'm gonna think, shift my weight into my left, come up, and then shift my weight into my right. Thinking about weight in both big toes, thinking about trying to bring that hip towards the opposite knee. You can move really slow through these, but the goal is to help you figure out how to shift your weight from leg to leg. For me personally, I found that this type of movement, such as kind of like this hip shifting movement, was really helpful during labor to help release tension in my pelvic floor, accompanied with like a really deep kind of vocalizing. So you can use that in your own birth to help relax your pelvic floor. But this movement is specifically creating space in the lower half of the pelvis, where internal rotation is really important. And internal rotation sometimes is really hard to find during pregnancy, so emphasizing it can be a really helpful thing to do. All right, so now let's do the strengthening movement that is going to focus on pelvic rotation, which is going to be our staggered stance RDL. With the staggered stance RDL, we're focusing on more of a hinge movement on one side, which is going to create space in the lower half of the pelvis. So my left foot is going to step forward, right foot back, and I'm going to hold the weight in my opposite hand because I want to bias more internal rotation. So for the upper mid pelvis, it was the same side. For lower, it's opposite. Now inhale to lower down. I'm going to think kind of like reach towards that foot, and then exhale to come on up. So inhales down, exhale, come up. And now as I do this movement, I want to think about my knee is staying fairly stacked over my ankle. So my knee is not coming forward, which is going to be more of a lunge. I'm thinking more of a hinge. So knee is stacked over the ankle. Exhale, come up. So that's going to help me feel it more in my hamstrings. And then I like to reach my arm back, which helps to kind of prompt more of that internal rotation. So this is helping to strengthen hamstrings. This is helping to pull that pelvis into more internal rotation. My foot is the anchor point, so this is a pelvic rotation movement, and this helps to create space in the lower part of the pelvis. Let's go ahead and switch sides, right foot forward, holding the weight in that left hand. As I lower, I'm thinking right knee stays stacked over the ankle. So still bending, but I'm not, so my leg isn't like super straight as I go. My hip is still going backwards, and I have a bend in the knee, but the knee does not track forward. So I have that contralateral or opposite hand hold, which is going to emphasize more internal rotation or more of a closed hip position. I've got the hamstrings being strengthened here, a little bit of that inner thigh to help pull the bottom of the pelvis more open. In about 10 seconds, we'll move to the floor to do our hip rotation movement that focuses more on internal rotation. So go ahead and place that weight down, and we're going to grab on to that yoga block, and we're going to come into a side lying position. Place that yoga block down by your knee, and you're going to place your top knee on it. So you can start in this like 90-90 position, place your top knee onto it, and then come into a side plank position. What we're going to do here is elevate the hips, and then this bottom leg is just going to rotate up and in. And so this bottom leg is what we're targeting with that internal hip rotation. But we also got some inner thigh activation happening. So exhale, drive that knee up. Inhale, back down. So again, with hip rotation, we're thinking about what the anchor point is. The anchor point here is my pelvis. So my pelvis is maintaining its position as my femur moves on it, which is really important. This helps to strengthen the inner thigh musculature. This top leg here is just kind of maintaining its position. So we have some inner thigh strengthening, and the inner thigh play a big role with the hamstrings to prompt internal rotation, which helps to create space in the lower half of the pelvis. In about 10 seconds, we'll switch to do the other side. At any point you need to lower those hips down, feel free. You can also keep the hips down as you kind of lift that leg up as well. Let's go ahead and switch to the other side. Throughout pregnancy, the inner thighs can sometimes get a little lengthened because we tend to favor a little bit more of an open position, more external rotation. And so doing exercises that target the inner thighs that feels accessible to you is really important to not only keep you comfortable, but also to help you prepare for birth. So put a little bit of weight into that top knee. And then exhale, drive that bottom knee up to feel that inner thigh fire a little bit more. And then inhale to lower down. And at any point this feels like a little bit too much, you can lower the hips down, but just kind of keep pulsing that leg. You can also think kind of drive down into that knee with the hips down on the floor. But if you want a little bit more, keep those hips elevated as you pulse this bottom leg. So if I had to hyper-focus on certain movements during my birth prep, let's say you're limited on time, I'm going to think about movements that help me find more of a rounded position. So those core exercises and lat releases, and then the movements that help to prompt more internal hip rotation. So adductor, hamstring strengthening exercises, and hip shifts are probably going to be like my top movements that I would generally focus on. Go ahead and lower the hips, but incorporating them all, if you can, would be great as well. So now we're going to come into a little bit more hip rotation on both sides. So we have external and internal in our 90-90 position. And we're going to add in the third thoracic positioning, which is the lateral mobility. So the rib cage can move front to back, it can move side to side, and it can also open laterally. So I have my left leg in front, right leg behind. So left leg is external, right is internal. And then I'm going to reach up with my left arm to come across to feel a big stretch in this side body here. Try to keep even weight between both hips. So we want to be able to find all three types of movements with our thoracic or our rib cage. So we want to find that front to back movement. So those can be like all our pelvic tilts. We want to find that rotational movement, which is any sort of like twisting in your spine, which you can do during pregnancy. But we also, and most commonly forgot about, want to find lateral opening as well and stretching through the side body. In about 15 seconds, we'll switch to do the other side. And you may find that one side feels a little bit tighter or has a little bit more restriction than the other. All right, so now let's do the other side. So I got my right leg in front, my left leg behind, and I'm gonna reach up with my right arm now. So now I have this big side body opener here. You can think like press the right knee down. You can think try to sit back into that left hip a little bit more. So right leg, emphasizing more external rotation in this position, left leg a little bit more internal. And you may find that one orientation was a lot easier to sit in than the other. So for me, this setup is a little bit more tight. It feels more restricted based on my common hip position. So for most of us, we tend to favor more internal rotation on the right and a little bit more external rotation on the left. So this is kind of that opposite setup. And I tend to be more compressed on the right side, which is a common pattern for most of us as well. All right, so now we're gonna finish up with the very bottom of the pelvis, known as your pelvic outlet. And so if we wanna create space in the bottom of the pelvis, we were thinking more about hinge exercises, so deadlifts, things that are gonna kind of target the hamstrings and the inner thighs. So we're gonna take our block and place it between the thighs, and then we're gonna grab onto our two weights, and we're gonna do our RDLs or our deadlifts here. So feet are gonna be about hip distance. And I'm gonna think inhale to push my hips back, and then exhale to stand up. So similarly to those Staggered-Stance RDLs, my knees are gonna stay stacked over my ankles as my hips move back. So I'm still bending in my knees. They don't have like super straight legs as I go back, but my knees don't track forward. If my knees track forward, it's more of a squat. You can also think about if you had a flashlight on your butt, where is it shining? With a hinge, we're thinking more shine the wall behind you with your butt. A squat is gonna be more the floor. So hinges are great to incorporate into a prenatal routine. It helps to strengthen the backside of the body, which during pregnancy we can all use more of. And more importantly, it helps to create space in the bottom of the pelvis with a movement pattern that tends to be a little bit more challenging. All right, so now we're gonna finish up on the floor with a little bit of internal rotation work. You can keep your block if you'd like. We're gonna start by bringing the knees a little bit closer and having the hips or the ankles be out a little bit further. So we have a little bit more like internal rotation happening here. And what we're gonna do is we're gonna kind of come forward in this rounded position and then just try to sit back as much as we can. And now your range of motion might not be that much, and that's okay. So think exhale, pull belly to spine, and we're going to sit back to our block, however is comfortable for you, and then coming forward. Big inhale, pull belly to spine. So we're focusing on here is I'm using my abdominal wall engagement to tuck the pelvis, not clenching in my glutes. So I'm thinking I'm pulling baby to spine, which is gonna tuck my butt underneath, and then I'm gonna just sit back, however is comfortable for me, feeling this big stretch in the lower back, and then try to keep that round as you come forward. So big inhale, exhale, big inhale to come forward. And that concludes all of the different types of movements that I would incorporate into a prenatal routine to help you prepare for birth. So we're going to be thinking about movements that target bilateral or both legs more externally rotated to help create space in the top of the pelvis. And we want to do mobility movements and strengthening exercises. Then we want to start thinking about the upper mid pelvis, or kind of like the upper half of the pelvis towards one side, to help baby begin to rotate into the pelvis. And that's where we're gonna have more of our open hip positions. So thinking kind of like those groin, kind of inner thigh stretches, in addition to our more open hip kind of strengthening exercises. So holding the weight on the same side. In addition to pelvic mobility, which is what we have when we stance the foot and the pelvis rotates on the femur, we also want hip mobility, where the pelvis is the anchor point and the hips are the legs are kind of moving around on that femur socket. Then we want to think about the lower mid pelvis. We have our one-sided closed hip positions to create more space in one half of the lower part of the pelvis, which is going to help baby to finish rotating. And this is the area where there may be a little bit more restriction or limited space based on common postural tendencies during pregnancy. And so we're thinking more of those like hip shifts movements, holding weight on the opposite side for more internal rotation, in addition to more of that hip mobility. And now when it comes to the bottom of the pelvis, we're thinking both legs more internally rotated with those hinges and more of those hero's poses to help create space in the bottom of the pelvis. And then with all of those, we also want to think about rib cage positioning. So we have front to back rib cage movements, rotational rib cage movements, and side to side. So as a quick recap, we want both legs to be able to find more of an open hip position. We want both legs to find more of a closed hip position. We want one leg to find an open hip position and one leg to find a closed hip position. And then we want the 3 rib cage positions of front to back, rotational, and side to side. So if you incorporate all 7 of those movements into your workout routine, you're going to create more space within your pelvis. You're going to release tension within your pelvic floor, and you're probably going to feel much more comfortable throughout your pregnancy as well, because pain is not a requirement of pregnancy. And again, if you want more support throughout your pregnancy and you just want me to tell you what to do, join our prenatal fitness programs where we incorporate all of this for you. We have our strength program, which is going to be self-paced workouts. We have our video-based program, which is going to be videos that you follow along more similar to this, but we do more rounds and there's less overall exercises in each workout to make it a little bit more easy to digest. And then we also have our educational courses. So if you are a professional and you want to better understand these concepts, you can check out our pelvic mechanics course and our pre and postnatal fitness trainer course. So we have a lot of things to support you throughout this phase of your life, and we're so thankful that you chose us to be a part of your journey. Oh, and if you wanted a discount, you can use code YouTube10 again to get 10% off anything off our website. So thanks for joining me.